Welcome back. It is 9:17. Whether you're an employer struggling to cover employee health insurance costs right now, or an employee who has been laid off or furloughed amid this pandemic, you do have some options when it comes to health insurance. So joining us over the phone to discuss those options is Craig Gussin of Auerbach and Gussin Insurance and Financial Services. Craig, can you hear me okay?
Yeah, I can hear you fine. Hi, Lauren.
Good morning. Let's start with the employer. Obviously, a lot of businesses are suffering with costs and bringing in some revenue right now, so it's difficult for them to cover their costs. What can an employer do if they can't cover their employees' health insurance costs right now?
What they can do is they can reach out to the insurance company that they have, explain the situation, make sure in the email to them they give them the group name, group number, what they want to do, how long, can they pay half by a certain day and the other half by a certain day, or what can they do? Most companies are following the insurance commissioner's request and giving everybody a 60-day grace period for paying late. So nobody should really panic. We're getting a lot of phone calls from clients going, how am I going to pay for this? So there's a lot of options available to them, and that's one of the things that we're educating them about.
And so what about the employees? If you happen to have insurance, not from work, but you can't cover the costs right now, or you perhaps don't have insurance, or you've just been laid off, what are some of the options for employees? Is it similar?
Yeah, with an employee, they have a couple options. They can go to Medi-Cal, and because they got laid off, they can go to Medi-Cal and get coverage. We can try and go to Cover California and get them coverage because that's a qualifying event. They got laid off. So there's a lot of different options they can go with depending on what they want. We're having a lot of the employees call us who are getting laid off and asking us, and we're walking through with them the options and figuring what's going to work best for them and which plan. And, we worked with somebody who was paying $400 or $500 a month for their health insurance, and we got them almost identical plan through Cover California for like $125, and they were really happy with that because with the unemployment they knew they could afford that. So Cover California, you can get insurance anywhere from $50 a month to $300, $400, $500 a month, depending on how rich a plan you want. So that's one of the things that we're looking at. And also I think the employer and the employees want to understand that they have a lot of options. The employers are calling me and asking me about what options do I have? And we explain to them that if you want to furlough employees and just keep them off for a couple months, you can keep the plan going. And a lot of employers are looking at that option. If the employee will pay their portion, we'll pay our portion maybe for a month or two and then decide from there what we're going to do. We're telling everybody everything is a month at a time. Don't start looking in October. Let's look at what we're going to do in April and May, and we'll go from there.
That's great advice, Craig, certainly. And if for people that are worried about enrollment periods and it being closed, those rules have changed. A lot of rules have changed because of this outbreak.
Yes.
So there is sort of an open enrollment going on that's been extended.
Yeah, there is, and it's to June. For most companies, it's through June. I'm probably having one or two webinars a day from insurance companies telling us what to do in the latest, and this is like every day. So as a health insurance agent, we're doing it every day. We're finding out what the updates are. We tell everybody the best thing to do is reach out to your health insurance agent. If you work for an employer, find out who the health insurance agent is, reach out to them, ask them what their choices are, because they already know about the layoffs coming. And work with them to find out what is my best option. That's what we're here doing. The insurance commissioner asked us we're one of the exceptions where they want us working. So my staff's working full-time, and every health insurance agent around the country is working full-time, so that people can look at every option and decide, is Medi-Cal better? Is Covered California better? Can they get coverage on their own? What should they do? And that's what we're here to do for them. So month at a time, day at a time. An interesting fact that people want to know is that most people are using telehealth. Kaiser tells me that between 80 and 90% of their doctor visits are through what they call telehealth, like Skyping.
Right.
Sharp is telling me the same thing. So use those if you get sick and you're not to see a doctor. Your copays are going to be anywhere from zero with Kaiser to other companies that are doing either your regular copays. So if you get sick and you want to go to the doctor, You can do it online. In most cases, it's working that way. So just work with your employer, work with a health insurance agent, the San Diego Association of Health Underwriters. We have a find an agent tag in there that you can look at and find an agent locally that can help you through this and guide you. Because it's really, things are changing every day, even for us. As much as I hear you guys on TV talking about what's going on different with the virus and, all the numbers that you were talking about today, we're getting the same thing on our end from what, the insurance companies are doing.
Right. The insurance options are changing. Craig, thank you
Yep.
so much. Such great advice for both employers and employees as we struggle to get through this. But good to know that you're a resource
Okay.
out there for everyone, and appreciate your time this morning.
Well, thank you. My pleasure. Good to talk to you guys.
Be well.
Take care, Lauren. Okay.
Well, a local restaurant is doing what it can to make sure that students are being fed during this time of